Low back pain and stiffness are the absolute worst, and unfortunately these days they are super common. To get rid of most low back pain, one of the things you need to do is learn how you can safely and effectively stretch key muscles that limit your movement and that cause you movement compensations or pain. Hi, my name is Teemu, I'm a physical therapist from Finland, and in this video we will show you two amazing stretches for a major muscle in the low back area. Most of our physical therapy clients have this specific tightness, and releasing it helps a lot. Before we begin, remember to like the video and subscribe. It will help us a lot, and and it's also free for you. It's the best deal you ever made. This bad boy of a muscle that we are stretching today is called quadratus lumborum, QL for short, and you can find this piece of meat here. As you can see here, this muscle attaches to the iliac crest, and from there it goes on to the lower ribs and to the lumbar spine. This muscle stabilizes the low back area during different functional tasks such as running, walking, jumping, and this is probably one of the reasons why this muscle often gets so tight. It's really common that the different stabilizing muscles of the hip and core are inactive or weak, and that's why the QL needs to work over time. In our clinical experience, the weak muscles are typically the medial glutes and oblique abdominal muscles. So it's a really wise choice to learn how to activate these muscles, train them, and this way they start to do their jobs and the QL muscle gets some rest. If you want to learn how to train these muscles effectively, tell us in the comments and we will make it happen. The QL is also a part of the side bending motion, especially when it controls the eccentric phase of the motion and when it helps you get back up to the center line. So the other common reason why the muscle gets so tight is because it's not moved through the full range of So the other reason why this muscle might get so tight is because it's not moved through the full range of motion often enough. Lastly, the muscle participates in the breathing process during inhalation, so it's really possible that breathing difficulties might contribute to the tightness. Before we teach you how to do the stretches, here's a list when you should avoid doing the exercises. Alright, now the boring theory stuff ends and the boring exercise stuff begins. Just kidding, they are super fun. Yay! So now we are going to show you the first exercise against the wall. Here is our male model Markus. Let's move his spine next. We start the exercise by getting ourselves against the wall. Place your hips, your pelvis against the wall, your upper back against the wall, and also your head, the back of your head against the wall. About the leg positioning, you step a little bit further away from the wall and also bend a little bit from the knees. The next step is tilting the pelvis against the wall, or backwards, so that the low back is against the wall. Alright, this will pre-stretch the QL muscle because it's also a little bit responsible for low back extension. Alright, and you will keep this positioning the whole time you are doing the exercise. Next, you start to side bend from side to side, and this will stretch the muscle. During the movement, no rotation from the upper back or pelvis is allowed, so if you notice this happening, then you need to correct the technique. Also, shifting from the hips is not allowed here, so correct this as well. Alright, do the stretching 1 to 2 minutes per session and repeat the stretches 3 to 7 times per week. In this exercise and stretch you can also try adding some extra weight. For example, we have the kettlebell here, but it can be anything you find and is suitable for you. The extra weight is good because it adds an eccentric load to the stretch, and this is good for building mobility. This will also strengthen the muscle, which is a win-win situation. When you do this with extra weight, you aim for different type of repetitions. So aim for, depending on your weight, aim for 12 reps and keep rest periods between sets and do 3 to 4 sets per training session. And do the exercise 1 to 2 times per week. If you have acute pain, do not do this exercise with an extra weight. Yeah. The next exercise is going to be a wild one. It's not as specific as the previous one, but it will mobilize the muscles really good, and you also get a nice stretch and contraction cycle to the muscle, which is good for the blood flow and activation of the area. Yes, so you begin by placing the Swiss ball on the floor and then you follow it. You place your hip on the ball and place your legs widely when you begin moving. You can also support yourself with your hand like this, and this is the starting position. Next, you do the posterior pelvic tilt, so you pre-stretch the QL. Next, you start the side bend. Try to elongate your side as much as you can. After that, you come up, so you get a nice contraction to the muscles. You can also improve or add the stretching feeling by reaching with the free hand. Do this with a pain-free motion, and if you have any pain, you can try to limit the movement, but if it doesn't work, then do not do the movement. Depending on your fitness level, you can do this 30 seconds up to 2 minutes per side, and you can do this 3 to 7 times per week. So now you know how to stretch this key muscle like a professional. Enjoy the results, and remember to like the video, comment below if you have any questions or stuff, and subscribe to our channel, and we will see you next time.